course we don't. I feel like I could click them and stuff would happen. Yeah, it doesn't actually work though, but yeah. One. We just put them in the calendar.
So we're just waiting for Kai Fakahara. Yep, I thought she came up here.
A minute and a half disappeared.
Don't come this side, Carrie. Sorry. Well, is that in the way of it? Just a little bit. All right, Rob. Tell me when you're set, Georgia. Good to go?
Yes.
Tēnā katoa. Good morning, everyone. My name is Memo Musa, and I'm Chief Executive of NZNO. So welcome to this press conference where we are going to advise you of the outcome of the vote on the latest DHB maker offer. So thank you for coming and being here today. I would like to invite you to have access to our press packs, which are on the table, which have got some additional information for you. I'd also like to acknowledge Kerry Nuku, our Kawhakahare, who is here today. And I'd also like to acknowledge Jill Mortimer and Erin Kennedy, who are delegates who are here with us today. And I will later on invite them to speak to you and to answer any questions which you have when you've had the outcome of the vote. So I'd like to invite C. Payne, who will speak to the outcome of the result of the ratification vote, and which is in line with the media release that is in your information pack. So see if I can ask you to come to the podium.
Kia ora koutou. NZNO members have been voting online over the last 7 days on the revised offer made by DHBs following facilitation, and voting closed last night at 5 p.m. Once again, NZNO's achieved a historic voter turnout, and this demonstrates our members' passion and their commitment to improving the health and well-being of patients and nursing and midwifery professions. The result of the ballot, while closer than previous outcomes, is that a majority of members have voted to reject the proposed DHB NZNO Nursing and Midwifery Multi-Employer Collective Agreement. The notice for strike action on the 12th of July 2018 remains in place. Our options have narrowed, and we are having to strike to achieve a better offer that secures additional money into the collective agreement to address outstanding member issues. In the event that there was a no vote, the DHBs yesterday requested a reconvening of facilitation as soon as possible. As a consequence, yesterday, the authority asked NZNO what our views were with regard to participation. NZNO was obliged to reply to this request without knowing the outcome of the ballot. Our response stated that given the clear statements by the DHBs and the Minister of Health about the unavailability of additional funding to support an improved offer, we have concluded that it is not clear to NZNO that facilitation is the appropriate forum in which to address the current difficulties in concluding the DHB NZNO MECA at this time. Breaking news this morning, just a short time ago, we were directed by the authority to attend facilitation. NZNO needs to comply with this legal direction. This ensures that we continue to meet our good faith requirements and obligations under the Employment Relations Act. Life-preserving services and contingency planning will need to continue in preparation for the strike action on Thursday, 12th of July. Significant work has already been undertaken by NZNO staff, delegates and members to ensure that patient and public safety is paramount. We will continue with our best endeavours to ensure that each DHB has a life-preserving services plan for immediate patient safety and an emergency management plan in the event of a significant disaster. Our message to members at this time is one of unity around the decision made by the majority of members who voted in the ratification ballot. Let us journey together for the health and well-being of the people of Aotearoa. Thank you.
Okay, thank you. You'll have an opportunity to ask some questions in a minute, but I would like to invite Kerry Nuku, our Kai Whakahare, to give you her thoughts.
Morena koutou. I'd like to reaffirm the members' decision on the votes today. And on behalf of the Board of Directors, we would like to acknowledge the members that have participated in this. It's been a long journey, and certainly to expect members to go to vote in such a short time and to have such a turnaround in voting output and participation in the votes, we want to acknowledge the challenges that this has created to all our members and thank them for this courageous move. We'd just like to say that patient safety and public safety remains paramount. We have a sound public health service. Nurses are part of a team, and we will continue to be part of that team as we lead towards developing life-preserving services, and we will continue to do our very best to support the work. It's a difficult time for everybody, and we understand that this has come as a surprise perhaps for some, but we want to reassure you we are still part of the team, and we will do our utmost to ensure public safety and patient care remains paramount priority. Kia ora.
Thank you, Kerry. Just to reiterate, you've sort of had the decision that the members have made is to reject the latest DHB offer. Preparations for strike continue for this Thursday, and nurses haven't taken this decision lightly. Public safety and patient safety is paramount. Nurses work as part of teams, and we are confident that we will ensure that life-preserving services and emergency management protocols are in place for Thursday. Thank you. I'd like to invite Jill and Erin to say their thoughts, and then we will take some questions after that.
So I'm Jill and that's Erin.
Hi.
Yeah, do you wanna...
I guess just I'd like to reiterate what C and Kerry said. Members didn't take this decision lightly. It's a very hard decision for nurses to vote to take strike action. And so what we're now focusing on is the life-preserving services, keeping our patients safe, and we've been working very hard on that.
I'd agree with Erin. So the focus for nurses all over the country now in the DHBs is to keep patients safe, and that's been sort of uppermost in their thinking throughout this time.
Thanks, Jill. Thanks, Erin. So we'll sort of open up for a few questions.
Memo, can I ask, so is facilitation going to take place, definitely going to take place? If so, at whose request or direction to the union, and when will it begin?
Okay, I'll let C respond to those questions.
So just to reiterate, the DHBs made a request for facilitation yesterday. The authority approached us to ask for our view. We made our view clear in writing to them that we did have a view that it was not clear to us that facilitation was the appropriate forum at this point in time. And since that time, this morning, the authority have directed NZNO to facilitation, which means that we must comply with that direction. And in terms of when it will commence, that's still being discussed, but the Employment Relations Authority has proposed that start at lunch, after lunch today, and we'll reconvene at 7 a.m. tomorrow morning, and I guess best endeavours to see if there is a resolution.
So can you give us some idea of the numbers in each direction? I guess you said that it was closer than previous votes. Can you give us a percentage split, so to speak, of where we're at?
No, we never provide our voting stats to anybody, so it's confidential and it will remain confidential. And it was closer this time, and I think we can say there's a clear shift, in terms of the vote, but at this point in time, we have a simple majority rule in terms of a vote, and that simple majority was met.
Why do you think there was that shift?
I think there's various reasons for the shift, but there were people saying, we've got some things into the agreement. There was a redistribution of money across the agreement for all occupational groups, and there was the implementation of pay equity within the term of the agreement. That may have persuaded some to say that that was a better deal. And I think, you know, on the converse side, there's probably, I think, two factors. One, the trust issue for our members, a trust in DHBs delivering on what they say, and so they are more inclined to want things very clear and articulated and legally, you know, spelt out within the collective agreement right now. Their experience over the last 10 years has been that promises around safe staffing haven't been fulfilled. DHBs haven't got on with their commitments around implementing care capacity demand management. So trust is a big issue, and I think we've got some step 7, as we say, step 7 issues to talk further about in terms of any possible future outcome that may be acceptable to our members.
So how much extra funding could make facilitation an appropriate forum in the union's view?
Well, we haven't quantified the sum of money. We obviously, it was clearly communicated to us that it wasn't affordable last time to maintain the progression to the step 7 as it was at that point on the date. So that there was a shift to get the money across all the scales, which was the first priority that members had in the survey indicated, but there were other issues obviously as well that were unable to be addressed because of the money. So at this point in time, we have no commitment for additional funding.
And you don't know how much would do that? Yet what you're saying is you want all those levels, the rises earlier than the board.
Well, the facilitation will, you know, the processes that you would discuss the issues, and the calculations around costs will be developed during that process.
So you've got no faith in facilitation, which you will have to start today?
No, it's not about not having faith in facilitation. If there isn't additional money available to facilitation for any negotiated outcome, we do not believe that that will provide the solution to the issues that our members are raising that would encourage them to vote in favour of any deal.
So if facilitation isn't the right process, what do you think is the right step?
Well, I think our members have determined that. I mean, they are talking about industrial action, and the majority of members have voted to support industrial action on the 12th of July.
And what happens after that?
Well, what happens after that is, I imagine, you know, the normal sorts of things. There may be some rethinking by DHB employers. There may be some rethinking by the government about what needs to happen to prevent further additional strikes. We would obviously have to consider balloting further if there was no shift at all in respect of the current impasse.
So have you notified the Minister of Health, and what has been his reaction to this decision?
Yes, the Minister of Health is well aware of our concerns and also where we're up to with life-preserving services.
So what would need to happen, do you think, to call off this strike or to prevent future strikes?
What will need to happen is there'll need to be additional funding put on the table from the government to be able to address and give some certainty to the things that members are requesting, and that certainty around progression and transition potentially, and dates within the collective agreement for other occupational groups as well, around implementation dates when things happen. So it does all cost money, and that would need to be there.
Do you think there's any likelihood that the DHBs may front up and do something to stop you striking, to try and alleviate this?
Well, the DHBs have a number of options. They can try and injunct industrial action. They can try, you know, challenge the process. We believe we've complied with all of the process. DHBs can also raise an issue around life-preserving services. Again, we've been thoroughly committed to making sure those numbers are in place and those plans are solid. There are a small number of DHBs. We've still got some numbers. We're working hard. Staff have been working all weekend to make sure that those numbers and those plans are signed off. So there's been every endeavour made by the union. There are difficulties because some of these areas, the staffing that are being required in the emergency or for the life-preserving services are more than what they normally have available to themselves on their rosters, and they've acknowledged that. They've acknowledged that thousands of hours of overtime are propping up some of the rosters in mental health.
Do you have a message for the patients who are sitting in the hospitals around the country obviously be affected by what happens on Thursday. What would you like to say to them?
Do you want to do that one or do you want me? Memo, I think, should.
Look, what I'd like to say to the public and to patients is that public safety, patient safety is paramount at all times. Nurses will be concerned and they will make sure and support us in our endeavours to make sure that life-preserving services do continue and to ensure that emergency management protocols in the event of a disaster are in place and that the services are able to respond to any need. So we are confident.
Can I ask on that point, Memo? This, of course, is unprecedented. Hasn't happened in decades.
Yep.
And nobody, I mean, nurses are the frontline workforce in all hospitals. They're about 60%, at least I think, of the whole workforce. Nobody seems to know quite what will happen without nurses. And we're still trying to get the life-preserving services agreements in place, I hear you saying. So how concerned are you about the issue of public safety, given what we don't know?
In a sense, Karen, we know that it's winter. We know that this is the time when DHBs are traditionally under pressure. We know that this is the time when occupancies are high. But in any contingency planning for a strike, it is the employer's responsibility to scale down services to a point where you have life-preserving services in place. So, I mean, DHBs would have been looking at outpatients appointments, as an example, elective surgery, and scaling that down to ensure that we have sufficient staff and our members to support life-preserving services. Yes, it's unprecedented, but our commitment is to ensure that we will have life-preserving services and emergency management protocols in place.
What if we get to a case where, I mean, I hate to tempt fate here, but what if we had a natural disaster of some variety on Thursday? Is there contingencies there to perhaps reverse the strike or to defer it if possible?
So if there was a natural disaster on Thursday, there is an emergency management protocol that will be activated by the DHBs and by ourselves. And that will enable us to be able to respond to that major disaster.
In terms of the number of nurses striking, how many do you envisage will be having to be taking part in terms of, you know, providing life-preserving services? How many won't be able to get away from that?
So it's DHB by DHB because they're all different in scale and size. If I give you as an example, we gathered in Auckland, you need a minimum of probably 1,100 to 1,200 nurses. And that's probably one of the bigger hospitals. It will be different in Wairarapa because it's a smaller hospital. They probably might need 300 nurses. So each life-preserving services is done hospital by hospital, as opposed to trying doing it nationally.
But across the country, you estimate a couple of thousand?
More than a couple of thousand.
What do you say to those people who have had surgeries delayed and are looking at the offers made by the DHBs, you know, at around $500 million, and they would think that's quite a sizable sum of money? What do you say to those people who had their lives disrupted in some way by this strike?
Look, I sympathise with those people whose surgery has been postponed and the surgery has been cancelled. It has not been an easy decision for nurses who have rejected the offer. In this case, we will actually make sure that life-preserving services do continue for those people who need urgent help on Thursday.
Are you expecting the DHBs to issue an injunction? Obviously, they're trying to avert the strike, but with a facilitation.
I'm not going to second guess what DHBs are going to do, Karen. I think, you know, our focus and our efforts will be to continue to make sure that we retain public confidence around ensuring life-preserving services are in place. But not only that, we work with DHBs as we've been directed this morning through facilitation through the Employment Relations Authority.
Who will lead the facilitation, do you know?
So the DHB negotiating team will continue to do that work.
Do you believe the DHBs personally yourself have acted in good faith throughout this process?
I think the DHBs have done what DHBs needed to do as employers, and in my perspective and in my view, the way in which the second offer was released probably undermined some of our processes.
So is it a no?
No, it's not a no. All I'm trying to say is the DHBs have acted in good faith, but when we go back and look at the previous offer to this one, the information that was released by DHBs publicly before we had the opportunity to notify our members undermined some of our processes and created a sense of like a trust.
Sorry, so just to clarify, you want additional funding, but you don't know how much you want?
If I can clarify in terms, based on what C said earlier on, when you're negotiating, the old style negotiation, you go and you say, we want X. Issues-based negotiation is not like that. You identify the issues and you work with your partners on how you're going to resolve those issues, including how much it's going to cost.
Have you come up with a number in past negotiations?
Sorry?
Have you come up with, in past negotiations that you've been having over the last few weeks, have you now come up with a number?
Number to what?
Money.
Yes. What we know for now is that members have raised issues, and the fact that they've rejected this particular offer based on redistribution of the current quantum of funding that was on the table is not sufficient.
Are there any issues that the NZNO is willing to compromise on?
We've compromised quite a lot. 10 years of underfunding, 10 years of low wage increases, 10 years of DHBs not fulfilling their commitments around safe staffing, and that's taken a toll.
From the union's perspective, you have recommended the latest offer. Is it disappointing to get knocked back?
It's our responsibility and our job as an organisation. We recommended, members have made a decision. We will work with members to support the decision that they have made, and that's our role.
We're talking a lot about the messages you have for patients and DHBs, but what's actually the message to your membership for those nurses who have voted to strike?
So the message to our members who have voted to strike is that we have heard them. We're going back to the DHBs through facilitation that we've just been ordered to attend, and we'll try and find a pathway of resolving their issues.
Do you think that there's been a role in social media in this whole debate? Obviously, we've seen a lot of interest in the Florence Facebook page. What can you tell me about your perspective on that?
Yeah, I think social media has played its part. Social media has played its part in enabling nurses to tell their stories in a way that has not been able to be done before. So I think that's been, quite unprecedented, in a way. That's also influenced members discussing the offer or the different offers that have been on the table. But it's also, on the other side, brought a kind of a sense of the need for members' voices to be heard even louder. So, I think, social media has played its part, and we've been actively monitoring social media channels in relation to the offer itself. And there are various different views. There are some members who, supported the offer. There are some members who are against. But, as C said earlier, we will go with the majority vote, which has decided that to reject the offer, and we'll work with that.
Mima, do you think the union, through this process, could end up fighting for its life in the form it is now? And do you think there's anything that you would like to be done differently?
I don't believe that NZNO will be fighting for its life. During this process, we have seen unprecedented membership growth, and I think that will continue. Yes, at the point when we resolve the impasse and we conclude this process, we will sit back and take a review to see if we could have done things differently and improve on what we will do in future.
But at the moment, you're critical of the DHBs for releasing information publicly without informing you first, or without letting the union have a say first?
Without giving the union the opportunity to inform its members. Okay, thank you very much. So if you'd like to have an opportunity to talk to Jill and Erin and Carrie and see, you are welcome to do so. Thank you.